Restless leg syndrome is a very interesting condition, and it is essentially a difficulty that a person has during relaxation. They feel that they have to move their legs. They have a sensation which is very bothersome often, and in order to fully relax, they will have to move their legs to get up and walk. This is a common way a person will try to relax their legs.
Patients that come into my office with restless leg syndrome are often fatigued, tired, anxious, and this really leads to a depression. It all stems from the fact that they're not getting to sleep at night, and then they're not being as productive during the day as they would like to be. They can't enjoy their daily activities, and again, it leads to a frustration level and even depression.
So the traditional treatments for restless leg syndrome are generally medications, and these are medications of a variety of types. Opioid narcotic medications can be used. There is a traditional medication, which is a levodopa medication, and also muscle relaxants can be utilized as well. And these are traditional treatments. These medicines have been along for many years and decades even, but they are difficult to use for several reasons.
Other risks associated with restless leg syndrome and the taking of prescription medications would be that of addiction, tolerance, things of that nature. Tolerance is where the body builds up a certain quote-unquote tolerance to the medication, and we have to continue to ramp up the dosage in order to get the effect that we want.
The Restiffic device is a foot wrap that applies gentle pressure to targeted muscles in the foot. The Restiffic device is very simple to use, but yet very effective for restless leg syndrome. You just simply wrap the device around your foot, adjust the straps, and feel the calming pressure that's provided to the muscles in the foot. This in turn will relax the leg muscles.
So I was initially a little bit skeptical. I think how most physicians, particularly medical physicians, are trained, we rely heavily upon treating our patients with medications. And up until this point, there really had not been a device to use for this group of patients. So there's certainly skepticism and suspicion to wonder if it will work. We did a clinical trial, which was a clinical trial involving approximately 25 patients. And this trial was held over a several-week duration. And these patients were placed on the device and then taken off of the device and again back on the device. So we could see how they responded to the device during certain phases of the trial. And what we saw was a very significant reduction of their restless leg symptoms. The end results of our clinical trial showed that we achieved about a 90% reduction to a score of mild or very mild, which was basically a 2-level score reduction.
I would not hesitate to recommend the Restiffic device to other physicians in order to manage restless leg syndrome because it provides us a safe and effective alternative to traditional medications.
I would absolutely recommend the Restiffic device to any physician practicing who sees restless leg syndrome. When you have the ability to initiate treatment for a patient that is not chemically dependent, it makes all the sense in the world.
So physicians, I think in this day and age, are really practicing with a mindset of what is cost effective and what is safe. And I think this device fits both of those criteria very well. And patients will like it and they will use it because it will impact their lives. And they will continue to use it because they know it helps them.